Hello, I'm Norbert Gleich, MD, and I'm the Medical Director and Chief Scientist here at the CHR. We live in crazy times. Every hour, the news media are reporting on new orders, closings, new rules, new things to do to avoid contamination from the coronavirus. It's a virus like many others. It is a virus with much less volatility and mortality than other viruses we have experienced in recent years. On the other hand, it is also a virus which is more contagious than the standard flu virus, and probably has slightly higher mortality, especially amongst older individuals and immunocompromised individuals. I am talking about the subject today because whatever field of medicine you are in, you're obviously affected by what is happening around us. Indeed, it is not only in whatever field of medicine you are in that you are affected. Whatever you do, whoever you are, wherever you live, you will be, and you probably already are affected by this endemic spread of the coronavirus. What I want to address here today is how it impacts fertility, how it impacts you, the viewers who are probably watching this video at this point. We are an infertility center. We help patients who are trying to conceive, and therefore our primary concern is how does all of this really affect patients who are trying to conceive. And let me therefore start with the absolutely best news. There's really, except for the general effects of this virus on society, on our behavior, on where we can go or shouldn't go, there is really no evidence at the present time that this virus has any adverse outcomes on fertility or reproduction for that matter. And that is very important to know this, because in that regard, this virus is much more benign than the standard flu virus, which has very significant effects, particularly on pregnant women and their children. Here we know from preliminary research that there appears to be no significant effect on pregnancy. In other words, women who got pregnant with this virus continued their pregnancies normal, and most importantly, the virus does not seem to cross the placenta into the baby, and therefore babies apparently do not get infected. We are very early in the history of this virus, and therefore it is entirely possible that what I'm telling you right now may change as we gather more and more information. But for the moment, this is probably the best news I can tell you today, that if you're trying to get pregnant or if you're already early pregnant, you don't have to worry. You are not at big a risk just because you're pregnant or because of you're trying to get pregnant and are taking certain medications. Indeed, if you are a woman, your risk is actually lower than that of men. And if you're a younger woman, and that is under 60, then your risk is really extremely low. And even though we here at CHR are treating the oldest patient population amongst all 500 plus IVF centers in the US, and probably amongst all IVF centers in the world, even we here at CHR very rarely treat women above age 60. And so I would like to end this with the good news that if you're trying to get pregnant, or if you are pregnant, there is no additional risk for you. Live your normal life, take the usual precautions. And if you have questions, get in touch with us. We'll be happy to answer them. Thank you very much.